Well, first of all, I want to welcome everybody to our presentation. In the last few years, we have done live presentations for this annual election period that's coming up. We've done webinars where you can tap into a webinar. This year, we thought we'd do something different, that we would just tape one video, email it out to you so that you can view it whenever you want to view it and go through what the changes are for the plans for next year. Couple things that I would like. We have hundreds and hundreds of people on these plans. And so the presentation that we go through every year is the Priority Health one because of how many customers we have on these plans. We have other carriers that we work with. However, as you go through this presentation, you're going to see reasons why we think that Priority Health is really the way to go for your Medicare Advantage plans, especially here in Northern Michigan. A couple of reasons why we recommend Priority Health as a company is the first one is their doctor network. Here in Michigan alone, their doctor network is second to none. You're going to see how that shakes out here in Michigan. More people select Priority Health than any other carrier. There's going to be a slide that will show that. And the other reason we really like Priority Health as a company is because you can go to any Medicare doctor in the United States, and Priority Health will pay their claims your claims as if you were in network. So the bills that they send will be paid as in network with any Medicare provider in the United States. That's really important for you to know that. Another thing that we've been experiencing lately with Priority Health is that their dental network is Delta Dental. We found out that other carriers don't have Delta Dental, and so we've been having issues with the dental network, and that the dentists might not want to participate in that. So those are things that we see out there of reasons why we want you to continue to stay with your Priority Health plan.
I'll interject into that too, Laverna, just customer service.
Oh yeah, definitely. Customer service
is fantastic.
Yeah, definitely. Yep. So we hope we can accomplish answering all your questions in this presentation. Obviously, we want you to be able to call us. Our contact information will be here at the end of this presentation. Email us. Email sometimes is better than calling because I can answer faster. Mm-hmm. But the other thing is that we work together. We call ourselves the dynamic duo with Ford Insurance in the Medicare world. So we want to make sure that you can talk to either one of us. We'll help you out if the other one is not available. So for the most part, Dawn customers will call Dawn, Laverna customers will call Laverna, but we want to work together to make everything as smooth as possible for you. The annual election starts October 15th, and it runs through December 7th every year. You need to know that. If you want to change your plan, you need to do it before December 7th. You should have received your annual notice of change. That had to be out by September 30th. If you haven't received it, you might want to connect with Priority Health and say, hey, I haven't seen it. But make sure that you look in 3 places. Some people get it by the mail. Some people get it by email, and then some have their Priority Health member accounts that it might show up in that as well. So just watch those 3 areas for your annual notice of change. That's going to show you all the changes that we're going to go through here on this presentation. But we'd like to highlight those things for you as well. So I get the questions a lot about, do I need to come see you, or is there anything I need to do to renew my plan? Your plan will automatically renew every year. So there's nothing you need to do unless you want to change your plan. And if you want to change your plan, there's going to be recommendations as we go through the slides of recommendations that we think that you should do in terms of changing your plan. So I think that's all of the I know, this is my favorite question. Okay. Am I getting all of the Medicare benefits that I deserve?
Joe Namath says you need them.
Yes, I agree. You need them. This is what he's talking about, is Medicare Advantage plans like what you have. And one of the biggest questions that I get is, am I entitled to the give back benefit? That one cracks me up. Well, what you want to pay attention to is that anytime you get given back something, you got to give something up. And the give back benefit, which is money back in your Social Security check for your Medicare program, that we've seen it in some counties down in Southwest Michigan, I think it is, and then down in the Flint area. And the other thing we found is that you have to have quite low income to be able to get that give back benefit. But the other thing is that just remember that if you get something, you might have to give something up. Like, for example, one plan we saw had no prescription drug coverage in it.
Right.
So anyway, that's just some things that we want to make sure that you know about that.
Yeah, the other thing to keep in mind with those commercials that you're seeing with Joe Namath and Jimmy J.J. Walker, and they're saying all those things. So keep in mind those are national ads. So they're typically not super relevant to our area here in Michigan.
Right, and they don't know you like we know you. They don't know the state of Michigan like we know the state of Michigan in these plans. So we want to make sure that you get the personalized care that you deserve, but they might even sell you a program that the doctor network doesn't work as well here in Traverse City or wherever you are here in Michigan. So anyway, enough of that. So this slide that you're seeing here just basically is telling us that more people select Priority Health than any other carrier. And these are the statistics to show that. We see that in our business, obviously. I said before that we do offer other insurance companies. However, this is our go-to company in terms of who we think is the one to go to for their Medicare Advantage plans. Here's another one that I said before, that more individuals choose Priority Health than any other carrier. These are the slides that show the statistics. This is the slide that shows the statistics on this, with how many people are enrolling in those plans and what the growth is throughout the Michigan market. Now let's go through the new plans for 2023, Dawn.
Yeah, so there are some new plans here for 2023. A lot of these plans are specific to the Grand Rapids and Southeast Michigan. And so since the majority of these plans aren't really relevant to the majority of our clients, we're gonna really bust through some of these slides. We're not gonna go through it in detail. However, if you do live in Grand Rapids or Southeast Michigan, we encourage you to call us and we would be happy to go into more detail of these specific plans. The first new plan that Priority has out there is called the Priority Medicare 1. That's available in Kent County, Ottawa, Wayne, Oakland, and Macomb. The next new plan is the Priority Health Kroger Plus plan. Again, this is in Southeast Michigan and the counties that you see there listed on the screen. The next so there's the dual needs programs. They've added a new dual needs, special needs program that's partnering with Kroger. That's typically in the southeast part of Michigan too, so you'll see the same 8 counties for the new D-SNP plan. And now we're going to launch into the plan details of the plans that most of you know very well. So we're going to launch into that. Now, as we launch into these plans, we're going to want you to take notice of the Michigan map there, all the different shades of green. Take a look at the shade of green of the county you live in. There's a corresponding region number. So take notice of what region you live in. That's going to be important as we go through the different plans. We're going to come back to this slide later on, but we just want to make sure you know what region you're in. For most of our clients, you're in Region 3. That's Grand Traverse, Laverna, and Benzie.
Right.
Okay, so the first one that we have is the Priority Medicare Compass. This is one of Priority's $0 PPO plans. In reality, the only major difference between the PPO and the HMO plans, it's very small, the difference. Really, the biggest difference between the PPO plans and the HMO plans is there is one hospital network in the thumb of Michigan, Harbor Beach Hospital.
You grew up there, didn't you?
My grandparents lived
Were
there.
you born there?
I was not born there, but my grandparents are from Harbor Beach, Michigan. I have visited Harbor Beach Hospital.
Okay.
It's a ER with a long-term care facility. So I assume that none of you are going to be going to Harbor Beach Hospital for any major care. So I think we could just kind of not even worry about that.
Yeah.
But the Medicare Compass plan would cover you if you needed to go to Harbor Beach Hospital. So to jump through some of the changes, there's not many changes with the Compass plan. You'll see rehab has gone from $30 to $20. Ambulance transport has gone up to $325. Tier 1 drugs across the board are now $0. So that's most of your generics.
That's for 90 days.
90 days.
Yeah,
Yep.
90 days.
90-day generic meds. And then the over-the-counter benefit has decreased on this plan. Oh wait, no, it's increased. My eyes are getting old. It's increased from $25 to $35.
Okay, this is the EDGE plan. I happen to like this plan, and I do have a fair amount of people that are on this plan based on the green areas that you see on this map. The things that people like about this plan is there's a $0 copay for the doctor visits. The plan itself doesn't cost anything. It's got some extra, the pop-up benefits and other things in there. However, I know that here in our region, Region 3, Grand Traverse, Leelanau, Benzie County, that it's not available to us. So, and these are the changes to the EDGE plan. You can see where, let's see. Oh no, it says the inpatient hospital. No, that didn't change. $350 on the inpatient hospital. Cardiac pulmonary rehab did go down a little bit, $10. Your labs are still $0. Your diagnostic testing went from $275 to $270. That's like your MRIs, CAT scans, and PET scans. Let's see. Outpatient mental health stayed the same. The ER observation and urgent care did go from 90 to 110 for the ER, 110 for the observation, and $30 for the urgent care. You're going to see as we go through these slides that this is what they do is they adjust the co-pays within the program to kind of accommodate some of the other things that you're going to see with some enhancements. Right. So, okay. This is the key plan. Now, I love this plan. It's available in every county that you see there. I have a lot of people that are on this plan. One thing that people like about this plan is that it does have the insulin coverage through the coverage gap or the donut hole that we talk about in the Medicare prescription drug plan. You've got the tier 1 drugs that you can get the 90-day supplies that's throughout the board, across the board with all the plans like that. And you're going to see in a little bit that the dental coverage has been improved specifically on the key plan and then a couple other plans that are not available so much up here in northern Michigan. But you're going to see a lot of changes with the dental in the key plan as we go. And of course, it's still $0 premium for the key plan. So here's the basic changes on key. There's your primary care doctor visit. It's $10 in 3 and 4. It's $0 other places. Your inpatient hospital stay, it looks like that changed. It stayed the same. They highlighted that. Your labs are highlighted there. Diagnostic radiology, that went from 150 to 160 in regions 1, 2, and 4. And in region 5, it happened to go down to 130. I'm sorry, 1, 2, 3, and 4 is the 150, and then now my eyes are going crazy on me. It's 160. And then is the copay for the diagnostic radiology, and then 130 in region 5 only. So read the slide. Don't listen to me, read the slide. There you go. So anyway, ambulance did go up from 250 to 270. And again, the emergency, urgent care, and observation, those also went up. On this plan. And again, the tier 1 generics, like we said before, is going to be a $0 copay for 90 days. And the over-the-counter drug, a lot of you in Region 3 and 4 will love this because the over-the-counter drug card went from $45 to $55 a quarter, so you got an extra $10 there. And then we've got Region 5 gets the $75 a quarter, and then Regions 1 and 2 get the $80 a quarter. So a lot of you I know like that over-the-counter card, and you know that they just reload it for you every quarter like that. Okay, Vital Plan, we don't have anybody in, I don't have one person in the Vital Plan because it just isn't as popular again up here in northern Michigan. Minimal changes to that. This year I'll kind of skim through some of these, some of the similar changes that we've seen with the other plans. The dual eligible plans, I do have more and more people that are qualifying for the dual eligible plans. What we see Priority Health doing as a company is that they are focusing quite a bit on those that are dual eligible. And what we mean is dual eligible for Medicare and Medicaid. And if that's you, come see me. I know exactly what these plans are, what they do for you. They're awesome. And I've got people that have experienced them, and they really work very well. So dual eligible, we'll kind of skim through that one here. Eligibility criteria you can see there for the dual eligibles is that you have to live in Michigan, eligible for both the Medicare A and B coverage, eligible for Medicaid, okay, and you have to be 21 or older. So those are your eligibility for the dual eligible.
Okay, I'll take it from here.
Yep.
The next one's going forward. All the plans that we're going to talk about going forward, if you're on any of these plans, that means you're paying a premium for your Medicare Advantage plan. A lot of these plans have just been around for a while, and give us a call. It's time for a review if you're on one of these plans going forward. It's possible that there's a better plan for you. The first plan that we're going to quickly look at here is the Ideal Plan. There's just a few highlighted changes there. The diagnostic radiology is down by $10. Ambulance has gone down to $240 on that one. The ER, that across the board, ER visits have gone up from $90 to $110. Again, across the board, the Tier 1 drugs are $0, and the over-the-counter on this one is $80 per quarter. So that's the Ideal Plan. The Priority Medicare Plan, these now we're getting into grandfather plans. You can still buy these plans, you can still stay in these plans, but we highly recommend on these plans now going forward, please call us. There is a better fit. Most likely there's probably a better fit for you.
We see no reason why you should be paying a lot of premium when you can get a $0 plan, and sometimes there's even more benefits in the $0.
A lot of times there are, yeah.
$0 plans.
They're really pumping the benefits into the newer plans, the $0 plans. The Medicare, you can see the Priority Medicare plan here. Again, we have increase in the ambulance, the ER increased to $110, the Tier 1 drugs, $0, and the over-the-counter benefit, they're actually offering that now on this plan, $25 per quarter. Otherwise, everything's the same on that plan. The Priority Merit Plan, now, again, this is a grandfather plan. You can stay in it, but please call us. There's most likely something more we can do for you on this.
I know years ago I wrote a lot of merit plans.
Yeah,
and
we have a lot of you that are still out there that are on the merit plan.
And if you're in one of these plans, I'm going to highly encourage you to give me a call and let's compare it with something else.
Yep. So yeah, so again, just some real minor changes here. You can see the highlighted on your screen. $20 is the cardiac pulmonary rehab now, down from $25. Ambulance transport went up by $20 to $270. And the ER, again, $110, and the Tier 1 at the $0 for the prescriptions. The Priority Medicare Select, again, another grandfathered plan. Give us a call. And very few changes on this. Ambulance price went up to $215. again, the ER and the tier 1 prescription drugs across the board had those changes.
All right, this is the value plan. This one I always say is a good value if you live in the Grand Rapids area. Years ago, I know I wrote several of these plans too, but as we go into the newer plans, if you're on the value plan, I'm going to highly recommend you go into the key plan. This one also has the value plan has the insulin through the coverage gap and such like that, but I especially Northern Michigan, I see no reason for you to not be in the key plan over the value plan. And then here's the changes that go along with that. And I know across the board you're going to see that the ambulance and the emergency benefits did go up some, and then some other little tweaks to the plan.
Yep.
And okay, I'm going to pause on this slide a little bit for the MAPD premiums for 2023. Just so that you can kind of get your eyes on what region you might be in and then what the price of your plan is. As you go through this, you're going to see that on the Medicare plan that the 1 and 4 regions decreased in price, but the 2, 3, and 5 regions all went up in price. The value plan, only region 5 decreased, the rest increased. Ideal plan across the board went up $1, so no big deals. You're also going to see that the dental and vision package did go up, but there's going to be good reason, and we're going to keep you in suspense.
Ooh.
Okay.
Sounds good.
All right, let's talk about dental and vision now.
Oh, you're not keeping them in suspense too long then.
Right, well, that's, I can't stand it. It's like a Christmas present. So anyway, now this is what I was explaining about before, is it's powered by Delta Dental. It's the largest network of dentists in the state of Michigan. It's their PPO and Premier network. That's a big thing for you to know. So if you talk to your dentist to say it's the Premier Delta Dental network. So you're going to see that in the key, the vital, and the Medicare Kroger plan, there's going to be some big changes in that. This year on the key plan, for example, that there was 50% coverage for your fillings and crown repairs and stuff like that. It's going to 100% coverage, and you get up to $1,500 per year in the filling area, for example, and crown repairs and non-surgical extractions. The Vital plan is doing the same thing. And then, of course, the Medicare Plus Kroger, that's a new plan that it also has that benefit in there. So that intense dental and vision package, this part is what we call embedded in the program that we're talking about with this 100% coverage for the fillings and such like that. This slide shows that there's been some enhancements on the dual eligible plan with the dental program. You're going to see that they upped the benefit $2,500 a year on the dual eligible program. So if you're in one of these plans, I can go over that with you as well. Vision, this is powered by iMed, and iMed Vision is a popular doctor network out there in the vision providers. You're going to see that most of the plans are going to be the $100 allotment towards their vision, and then some of the other plans are going to have other various allotments for the vision. Again, a lot of those plans aren't available in our area, and we just, for the most part, the ones that we use a lot are going to have the $100 of eyewear in their program. So, the other thing we want to mention is that the out-of-network coverage, if they don't participate with iMed Vision, you can go out of network and still get reimbursed for that. There is a form that we have you fill out. Now, the optional enhanced dental and vision. This was the one that I was saying that you get some extras in here now. Now, the key plan, the vital plan, and that Kroger plan, the optional enhanced dental and vision package is going to go to $29 a month. And the biggest reason why is because now it covers dentures, new dentures. Before we always had just the denture repairs. Was that what it was? Repairs on dentures and bridges. Yeah. So it was only repairs, like you're going to get a repair on something like that. But new dentures are now covered. You got 50% coverage. You still got the same coverage for the implants, crowns, root canals, those types of things, and it's all 50-50. The downside is you got to pay the other 50%, but it will pay up to $2,500 a year.
Bumps the annual annual coverage limit up, which is
Yep.
that's a great annual coverage limit there.
Oh my gosh, it's better than some of the group dental plans that we have out
easy.
there too,
Yep.
or even the individual plans and such. And then on the other plans, it's $38 a month. You can see the other plans that have the $38 a month on that. Then it also adds the extra $150 of eyewear. So this is a nice package deal. Always remember it's a package deal. You're not paying for just the dental. Always remember you've got the vision, extra vision coverage.
So the vision, it's takes it from $100. You add the $150, so now it's $250.
Yeah. So that's
pretty nice.
That's a great benefit. On this slide, we're going to go through some more details on the Enhanced Dental and Vision Plan. Always remember that it runs on a calendar year. There's no deductible or waiting periods. That's huge. I mean, some plans will have a 6 to 12 month waiting period on the dental plan alone before you can get, like, say, a crown or something like that. So there is no waiting periods. That's beneficial for you to know. Again, the benefits are offered as a package. We kind of covered that one before. It's really easy to enroll if you don't have this one. We send you a link. We can guide you through that if you want to enroll into the plan. If you want to disenroll from the plan, there is a paper app that we have to have you fill out now for that. So I really encourage anybody that has dental vision to keep this on their plan and just keep it going, okay? And then, of course, you can find your doctors if they participate at the Delta Dental, the Find a Doc under the Priority Health Dental and Vision networks for the Delta Dental and the iMed Vision. Hearing, this is powered by True Hearing, and you do need to go through the True Hearing providers to get this. And I know there's plenty of True Hearing providers in our area. This is where, if you go through the True Hearing, you get the zero copay for the hearing exam. Now, Medicare covers hearing exams, but typically that would be like an office visit copay, $45. But if you go through this True Hearing, you get the $0 routine hearing exam. And then, of course, you get the help with the hearing aids. You can see the copays that are aligned there for hearing aids. And it depends on how expensive the hearing aids are in terms of what kind of a copay that you're going to get.
Yeah, that's an important detail there too, Laverna, about you have to go through True Hearing. So this has been one of probably the biggest confusions that I've had with the hearing is people will say, well, I made my appointment with my audiologist and now True Hearing won't cover it. So what we mean by you have to go through True Hearing, right. You actually have to call True Hearing to set up your appointment with your audiologist. Mm-hmm. So it starts with True Hearing and then everything should run smoothly from there.
Yes. And I've had customers that have had great success with that.
Yes.
And very happy to get their hearing aids and be able to hear again.
Yes.
What? My husband says I need them.
Huh?
Yeah. I mean, well, that's another story. Anyway. You get a 60-day trial with your hearing benefits. There's a 1-year post-purchase follow-up visits that you get with that, and of course, rechargeable, or 80 batteries, but the rechargeable batteries are not included. So, nice benefit.
Okay, now we get to talk about some of the fun stuff here. It's the embedded extras that are in the plan. It's a lot of fun here. So the first one that is embedded into a few of the plans out there, not all of them, Compass Edge Ideal, the One plan, the dual eligible plans, and the dual eligible Kroger. They embed into those plans a program called PAPA, Companion Care with PAPA. And basically what these plans do is they partner with what's called a PAPA Pal, and it's a college student or somebody that they've trained through the PAPA program. And
they've tested out to make sure that they're good people.
Quality
they're
people.
Not, that aren't going to take advantage of you or
exactly.
That kind of thing.
Yep. And they can come and do some household chores, light household chores, transportation, some grocery shopping, light meal prep, companionship. They'll sit there and watch a TV show with you or play a board game. Yes, Scrabble. Yep. Technical setup, just kind of I got this new machine. How do I set it up? Yep. Papa can help with that. And there's an unlimited Papa concierge. Am I saying that word right? Concierge?
Yeah, good enough.
there's a PAPA person who's going to help you navigate through the plan benefits and schedule appointments and all those details. Along with that PAPA program, there's unlimited caregiver support with members of Priority Care, which includes just advocates, advocating social needs, housing insecurities and resources. You can see the list there: legal aid, key financial planning. There's just a lot of caregiving support that comes with that PAPA program. And members are matched to specific advocates on their unique needs. So if that's something, if you have one of those plans, you can contact the PAPA number that comes with that plan to get set up with a care advocate. So this is something new that's embedded into all of Priority's plans. It's called a bridge. This is, I actually love this. As a daughter of my dad, who has a ton of health issues, and he goes to doctor's offices, and then I ask, how did your doctor's appointment go? Fine. What did the doctor say? I'm fine. No, that's not what the doctor said. And I feel like I'm in limbo. So what the Abridge is, it's an app on your smartphone, and it records the conversation with your physician. And then it'll give a transcript of the appointment that you can send to your children, that you can send to somebody close to you, maybe somebody that you know who's a nurse and you want a second opinion, or can you help me translate through what the doctor said here? Mm-hmm. It's just a really great tool to have basically a second listening ear there during your doctor's appointments. So that's just an app that you can download onto your phone and set that up. So kind of a nice one there. Virtual visits continue to be a $0 copay with your primary care physicians, your specialists, and your behavioral mental health specialists. And you also would have 24/7 access to a virtual care through Spectrum Health now, which means if you can't get in to see your doctor, you can get in touch with a Priority Health, Spectrum Health Care.
Virtual care has been a really big thing with COVID.
Yeah.
So,
and even with people who are like rural people,
yeah,
where it's a long distance to get to a physician, a lot of people are really kind of liking this virtual care. So COVID did improve some of our lifestyles as far as virtual care and things like that. Yeah. That's the only thing, I'm pretty sure, though. Transportation is embedded on the Priority Medicare D-SNPs, also on the Priority Medicare 1 and the Kroger D-SNP. So again, it doesn't pertain to most of you, but there's transportation involved with those plans. We can tell you more if need be. Personal emergency response, from what I understand, this is kind of like that life alert type of a thing, if I'm not mistaken. It's powered by Critical Signal Technologies. It utilizes a cellular network, and this is for all D-SNP members. So it'll alert somebody if you fall in or need help like that.
Okay. You always want to remember that Priority Health covers every major hospital system in Michigan. So remember we said in the beginning that there's that little hospital that Dawn was almost born in it, I can tell. But anyway, that little Harbor Beach Hospital is not in the network, but every other major hospital system in Michigan is. So that's very important for you to know that. And then, of course, the Travel Plus now includes the Upper Peninsula. I've been able to share that with some people. It used to be we would say that the Upper Peninsula was considered out of network and you might have a deductible and such like that. But now if you really want to go to that specialist in the Upper Peninsula and get a second opinion on your whatever it might be, a heart specialist, for example, you can go. You can, and as long as they're a Medicare doctor, you can go doctor in the Upper Peninsula. Always remember that emergency, urgent care, and ambulance, we like to go camping up there, or any place you go in the whole entire world, you're covered under the emergency, urgent care, and ambulance benefit. But now you can doctor in the Upper Peninsula. That's kind of a big deal. The visitor travel pass benefits allows the member to reside outside of Michigan for 12 months. I know I've had a couple clients that have taken advantage of that. I actually have a friend that is currently going through some cancer treatments in Florida, and I think they're going to be gone down there for close to 12 months, but I guess that proves to you that it works, that you can be out of your travel, or out of your home base for 12 months like that. You pay in-network co-pays at participating Medicare providers. So this is what we were saying before about you can go to any Medicare provider and they'll cover that. They also partner with MultiPlan to offer better access to Medicare providers outside of Michigan. That MultiPlan symbol is going to be on your card, so they can see that. But the travel pass, basically what you want to do is make sure you hand that to your providers, and then they will connect directly with Priority Health to make sure, and then Priority Health will make sure that those claims are paid as in-network. So if you ever have any questions on that, always let us know. We can be great traffic directors on all of this. For sure. Traffic directors on a travel pass.
I see what you did there.
There you go. I just thought of that. Anyway. Members can see Medicare participating dentists in Delta Dental's commercial network outside of Michigan, Indiana, and Ohio. So always remember that you can go to those other states for the Delta Dental. Plus all plans include unlimited worldwide emergency and urgent care. We talked about that before. And of course the Assist America is in there. That's a great travel accident policy. So if you forget your luggage, or what if they got to airlift you back to the United States from Timbuktu, that travel pass is a very...
Prescriptions, you forgot your prescriptions.
Yeah, that travel pass is very important for you to know that it's part of your package.
I like the fact that they give you a travel pass card as well, because Priority Health is a Michigan-based company that when you get down to Florida, I've had some people say, well, I gave my insurance card and they said, we don't know this company. We don't cover it. So I said, did you give them your travel pass? Because that is a visual that says, this plan is good here. So I always recommend that. And the phone number that's on that travel pass will put the billing department of that facility in touch with a dedicated team that deals with the travel and be able to answer their questions really easily. So
that department is awesome.
Yeah, for sure.
So if you need to, take advantage of that. So. Again, here on the Travel Pass, it's got the Assist America, which includes the emergency travel assistance when traveling more than 100 miles away from home. It's available everywhere in the world, 24 hours a day, 365 days a year. The benefit will connect members to doctors, hospitals, pharmacies, and other services if they experience a travel emergency. And there's no exclusions for pre-existing conditions or extreme sports, hazardous hobbies. So you can go do your mountain climbing.
Yeah, go skydiving.
There you go. It also includes emergency evacuation or transportation to the nearest facility capable of providing proper care if care is not available locally. Round-trip transportation for a family member or friend to be with the member if expected to be hospitalized for more than 7 days. They'll pay for an airline ticket, basically, if you're going to be in the hospital for more than 7 days for somebody to come be with you. Help replacing your luggage, prescription drugs, and of course we know they'll help with the luggage, retrieval of vehicles or other valuable property left stranded because of a medical situation. So that travel pass, I think that's an awesome benefit. Extra benefits designed to support the whole body health and well-being. These are fun benefits. So,
all right. So the first one that supports our well-being is Silver Sneakers. So for those of you who are familiar with this, it's a program that partners with local fitness facilities. There's many in our area that partner with Silver Sneakers. which means you get to go to a fitness facility for free. So you just have to go to silversneakers.com to find out which gyms are partnering with Silver Sneakers, and then just you go through and kind of fill out your registration that way.
The other thing that's cool is you can gym hop.
Yeah.
So you can, like, if you want to have a Planet Fitness membership here locally, and then you want to go to another state and get Planet Fitness there, you can. It's the same membership. So okay.
Acupuncture for you people who like to stick needles in your body. It is covered. It's a Medicare covered session, 20 Medicare covered sessions for chronic lower back pain, but priority adds in some extra conditions that are not just for chronic lower back pain, and covers things such as chronic pain, anxiety, sleep problems, headaches, and side effects that come with chemotherapy. So
that's a nice benefit.
It's a nice benefit. I know some of you really enjoy that. To me, it sounds really scary.
So Brain HQ, this is a personal gym for your brain. Okay, it's included on all the plans. There's 29 online exercises that will help your attention, brain speed, memory, people skills, navigation, and intelligence. It can be accessed via your computer, tablet, or smartphone. And research shows that it helps out, these things help out with less depression, more happy days, improved focus, 48% fewer at-fault car crashes, 135% auditory processing, and better self-rated health. So good thing to keep us out of dementia and Alzheimer's and all those horrible things that I hear so many people getting. So.
Yeah, another embedded extra is the My Strength program. It's continuing to offer because 1 in 4 adults age 65 and older experience mental health problems, and we're seeing that more and more, right? So they're offering free access to online mental health wellness tools to help manage depression better, to help with sleep, reducing stress, finding daily inspiration, improving your mood. You can opt in to having a dedicated one-on-one coach while you go through this program.
So, and as we go through this, one of the things that I see with Priority Health as a company is that they are very geared to want to make sure you stay healthy. And if you stay healthy, well, guess what? You win. And then, of course, the insurance company wins because there's no less claims out there. But anytime we can keep people healthy, it's better off for everybody.
Absolutely.
And so you're going to see these extras these are things that Medicare doesn't offer. They're just all extras in these plans that you see here.
Very proactive.
Very proactive. Mm-hmm. So over-the-counter allowance. I've had people have fun with this. My mom loves this one. She likes to go shopping, and so do I. So anyway, it's powered by Convey Income. There's 3 convenient ways to shop on this one. You can do through the mobile app. You can call to order, just call out of the catalog. My mom likes that one because it ships to your doorstep and there's no shipping charges. You can go to a store and buy your items. Now, when you go to the store and buy the items, you do want to take the catalog because if it says it's 100 tablets of Bear aspirin, that's what you want to pick up or whatever it shows in the catalog like that.
Matchy.
Yep, and you can go to Walmart, CVS, Kroger, Walgreens, and Rite Aid, and now you can go to Family Dollar and Dollar Tree. So those have been added this year. And then, of course, free shipping again on the phone orders like that. And you can see over to the right-hand side, each one of the benefits and what the amount is that you get quarterly. Don't forget that they load that card quarterly on the quarter, January, April, July, and October. And it's use it or lose it. So use it. This is going through the other plans, the ones that we said before that are not in the over-the-counter plan for the ones that we know that are not so much in our area. If you have questions on that, we'd be glad to go through that with you. Keep in mind that when you get your over-the-counter card, that members will receive a welcome packet with the over-the-counter card and a catalog so you can review what items you want to pick up. The catalog will also be available at PriorityMedicare.com if you lose your catalog, or you can call the customer service and get a new catalog. The card is not loaded a card will not be sent each quarter for the over-the-counter? I've had people ask that question. And always hang on to that debit card, because each quarter it gets loaded on the quarter, January, April, July, and October, with your quarterly allotment like that.
More benefits, again, being very proactive as a company. They are doing better to manage our chronic conditions. So one of the things that they do is what's called the Free to Talk physical. That sounds really interesting, that somehow people wouldn't be free to talk at their physical. But what they mean by that is you can talk about anything going on with your health and not be flipped into a diagnostic visit to your doctor. So a lot of times what happens, you go to your physical and then you're like, well, my knee's really been bothering me. And so then it turns in, they say, oh, we want to diagnose this. And now you're getting billed for this physical, which you shouldn't be. So they basically say there's no hidden fees. They are being very proactive to make sure they cover that cost. You're free to talk. Plus, there's $0 on all anticoagulant labs, palliative care, enhanced disease management, in-home safety assessment, nutritional education, post-discharge in-home medication reconciliation, and telemonitoring is all included at no cost.
Okay, post-discharge meal benefits. This is a really cool benefit from Mom's Meals. I actually did a webinar on this last winter when I had nothing better to do. No, but it was a really good webinar on Mom's Meals. This benefit is for when you get discharged from an inpatient hospital stay. So what happens behind the scenes is that this company gets an alert when you get released from the hospital, and then this company will contact you, and you get it's $0, zero copay for up to 28 meals. The other thing that's really neat about this benefit is they will tailor it to your dietary needs. So if you need gluten-free, for example, order gluten-free.
Low sodium.
Yep, all
those
that.
things.
Yep, so it's a really nice benefit.
So it very much looks like those HelloFresh or those things where it's a prepackaged meal, easy to just pop in the oven or the microwave. And from what I hear, they're pretty darn good.
I've heard that before too. So, okay, prescription drugs. Here's some of the highlights. Again, back to the 90-day refill at a preferred pharmacy on all Tier 1 across the board on all plans. Diabetics with their insulin, it's a $35 copay for a month supply. That's across the board. That's new for this year. All generic HEDIS drugs are moved to Tier 1. And then, of course, the diabetic supplies are moved from Tier 4 to Tier 1 on that. Those are all big deals on the pharmacy benefits. Many generics and insulins are moving to Tier 1. So you can see there where insulin supplies from the Tier 4 to Tier 1, all the insulin things that you need, test strips, syringes, and so on. And then the diabetic drugs that are moving to Tier 1 are the glipizide and metformin. And I won't pronounce the other two, but you can read what those are. So if you're on one of those...
You know if you're on one of those.
Oh, exactly. Yep.
Leave it to you to pronounce it.
Yep.
All right, I get to jump into the Medigap plans. There are several of you with us that still are on the Medigap plans and love the Medigap plans. And I think the Medigap plans definitely have their place and position in people's lives. But however, with the change of Advantage plans and the rising cost of these Medigap plans, again, I would highly encourage you to talk to Laverna or myself to see if that's still the best fit for you. Mm-hmm. It may well be, but we want to make sure. The thing I love about Priority Health's Medigap plans is it's just got a proven track record. It's competitive. Mm-hmm. It's competitive. It's got very stable rates. I used to be an agent with about 15 different Medigap programs, and we just saw the rate fluctuation just go crazy. Priority Health does really well of keeping the rates very stable. It has a 12-month rate guarantee with all renewals. If you are on a Plan F, you are noticing that your premiums are increasing rapidly. One nice thing is Priority will allow you who are on Plan Fs to move to Plan Gs with no underwriting. That's huge. A lot of you have remained in a Plan F because you know you wouldn't be able to pass the underwriting that it would take to change. So again, if you're on a Plan F, please, please, please call us. A Plan G may be more better for you, or looking at the Advantage plans. We'll take a look and see what fits your needs best.
Anymore, I see on the Medigaps that if you're going through a lot of care, sometimes the Medigaps make sense.
They have their place.
They have their place. And then once in a great while, I'll have somebody that will say, well, my company's going to pay for this insurance, or somebody else is going to pay for it.
Somebody's going to pay the big dollar.
Yeah,
Go for it.
Yeah. I still like to tell people, let's go through the math and make sure that the Medigap, because it doesn't have all the Advantage things in it, like the Advantage plans.
The math speaks. So.
Yeah. And then, of course, with the Medigaps, you have to still buy the prescription drug program, because otherwise the government's going to penalize you if you don't have prescription drugs. Right. So if you ever have questions on that, we can go over that
Absolutely.
with you. Okay.
Another nice part of the Medigaps, if you and somebody in your household are both on a Medigap plan with priority, it's a 12% household discount. You can see there what a household is defined as and what it's not defined as. So. But 12% household discount is nice. Again, just like I was saying before, it has very competitive premiums. We're seeing a steady rate on these premiums. So yeah, it's definitely my preference is to go with a Priority Health Medigap plan over all the other ones, just because of the steadiness of it.
Yes, and once in a while we'll find companies that will do what they call those teaser rates.
Yep.
And or I call them teaser rates, to get you in the door, and then the premiums go up significantly. So just be aware of that. Okay.
Emma wants us to be aware of that too.
Yeah.
Yeah. Thank you, Emma.
Yeah.
We want to be aware of that. Yeah.
We love you, Emma. So anyway, frequently asked questions. So what we're trying to do here is to do the best that we can. What we did is we took the questions that we knew you had from last year, and we're going to try to ward off as many questions as we can so that you have the answers right in this presentation. So.
All right. So the first question here is, do I have to do anything to continue with my plan, including my dental plan? Mm-hmm. If I love my plan, I want to stay on my plan, do I have to do anything? No. The answer is no. You just let it ride. It will automatically renew. You'll get new insurance cards for your medical. The dental is included in that insurance card, but you don't have to do anything. Next question would be, what if I want to add dental or vision to my plan? Laverna touched on this earlier. Mm-hmm. We can send you a link that will easy peasy run you through the enrollment of that dental plan.
And don't forget, if you want to disenroll, there's a separate, it's a paper app we have to actually do. So,
what do I do if I want to change my plan? I'm on a merit plan and I want to go to the key plan. You can discuss that with us.
Mm-hmm. I like to consult you with whether or not it makes sense to go from one plan first and then,
Yeah, let us consult with that. But you can also just call the Priority Health phone number. Let them know that Laverna or Dawn told you to call your agent, and we want to change my plan to the key plan or whatever plan it is. And they should do that right over the phone with you.
And it's that phone number, it's the customer service number on the back of your card.
Yeah.
So
I think you have the next question there.
Do I need to show my red, white, and blue Medicare card? No. You can take that little card and you can tuck it away and keep it. It's your private information, but just keep it in a safe space. Do I get a separate card for the dental and vision? Nope, that's all embedded within the card. What's in their Priority Health card is your medical, your hospital, your prescription drugs, your dental, your vision. All of that is hearing aids, true hearing, that kind of stuff. The gym membership, that's all in the Priority Health card. And then, of course, this other card that you get is the travel pass that we talked about.
Will I get a new card this year?
My screen isn't showing where
I got you from here. I'll ask you the question.
Okay.
Do I get a new card this year? I kind of touched on that.
No, you keep the same card as what you have. we've had it where midstream Priority Health has always said, no, certain plans are going to get a new card or whatever. We'll try our best to make sure you know if that's happening too. So
yeah, Laverna touched on this next question as well. Do we need a card to use the over-the-counter allowance? Yes. You get an over-the-counter healthy benefits card. You'll need that number if you call the phone number that's in the catalog or go to the website. You'll need that number that's on that card. You do get a new one every year, but not every quarter. So it's good for the entire year.
Yep.
And we should see those new cards coming out after the first of the year, I believe.
And then it's a debit card, so you just activate it like any other credit card or debit card that you would have gotten. So,
Laverna, the next question I'll let you answer here. Are vaccines covered? Shingles, COVID, flu shots?
Yes. And the shingles, we found that the flu and the COVID are zero copays. And then the shingles usually, I think, is a tier 3 copay is what I've seen.
The shingle shot goes through your pharmaceutical coverage there. So, Laverna, what does $0 premium mean?
I love this question.
It sounds too good to be true.
So, before we went over the plans, there's zero premium to the plans. I'll have people say, how can an insurance company offer me a product that's zero premium? Well, first of all, I want to make sure you remember that you're paying for Medicare out of your Social Security check or directly to the government. So there is a charge that you are paying. Sometimes we just forget about that because it's automatically taken out of the Social Security check. But what's happening behind the scenes is all those dollars that we've paid into Medicare over all those years are being used to fund these programs. And insurance companies like Priority Health they are actually graded on how well they perform. There's this 5-star rating out there, 5 stars being perfect, which is very difficult to do, but 4.5 to 5 stars is what Priority Health has been graded all these years. And so how they're graded is that the government funding is sent to these companies, and the better they're graded, the better the reimbursements they get. So the Medicare dollars that we've paid into all of our working years, our employers have paid in, and guess what? You're still paying into the Medicare system, Part B premiums and such. Those are all being used to fund these programs and sent directly from Medicare to fund these. So the bottom line is that you're still paying for it. So, okay?
Another question we get are the overseas medical benefits comparable to a travel insurance medical plan?
That's a tough question. I always tell people to compare what you've got on the travel pass, travel accident benefits to what the overseas
your plan here with Priority is going to cover any accidents, emergencies, or ambulance.
Yep.
Sometimes if you get travel insurance, there's some coverage there as well. But I will say, if you're taking an extended trip and you want a more robust health insurance, give us a call because we can help on that as well.
Yes.
So we help with travel insurance and with medical travel insurance. So we certainly can help you out forward with that. And Laverna, we're going to talk about Joe Namath and J.J. Walker one more time.
Okay.
Let's talk about these benefits we deserve.
And just remember, you are getting all the Medicare benefits that you deserve with these plans. This is what they're advertising. Again, just always remember if it sounds they're talking about like a give back benefit or something like that, that there's something that you have to give up, and those are only available in very specific areas of the state of Michigan. Right. So anyway, just if you have any questions there, and always be careful with those 800 numbers. And like I said before, they don't know you like we know you and what works up here in our area. We study this stuff every year to make sure that we're passing on the best that we can to our clients. So with that,
I want to say too, just before we close here, I've had a lot of phone calls this year I got a phone call from somebody saying they are a advocate for Priority Health and wanted to talk to me. That is typically somebody trying to sell you something else.
Yeah.
So if you get any of those mailers, phone calls that just feel a little wonky, let us know. We can help you kind of cut through the weeds of that and make sure you're staying safe.
We're always happy to answer questions. We always want to be available for you. And so to wrap this up, let's thank you for listening to this video. And we know it's kind of long and probably more details than you wanted to know, but we tried to cover as much ground as we could so that you understand how this whole election period, annual election period works. And again, our contact information is going to be on the screen for you. Always feel free to let us know if you have any questions or concerns. We're here to help you out. Thank you.
Thanks.